Dr. Buford, we're just getting started on your right shoulder. Your shoulder was very unstable when we examined you under anesthesia, which is what we expected. And now we're just getting started with our first look inside. We're looking from the back to the front. We've got 2 cannulas coming in the front, metal one on the left, gray plastic one on the right. Here's your biceps tendon right here. Your biceps anchor actually looks pretty good down below. A little bit of fraying in the cuff. We'll put a side-to-side stitch across that using a high-5 suture towards the end of the case and examine it from the other side. As we look down, we can see that there's no loss of bone and that you actually have some labrum there that looks pretty good. So the next step is for us to put the camera in the front and have a look from the front to the back. But we are getting a pretty good idea of this kind of multi-directional instability picture, which is what we expected. Pause, please. Okay, so what we're looking at here is the posterior aspect of your shoulder. We're going to place an instrument in called a rasp, and we use this to roughen up the capsule back here. You can see a little crack in the cartilage. We're going to put in an anchor right here. And because the labrum's a little bit damaged here, see that? We're going to place a suture anchor down to help repair that. Focus. There we go. Okay, so we'll take a spinal needle. Looks like we could place our anchor down around here. That'll give us a chance to repair everything. Okay, so hold the camera there and stuff. I need the blunt. I need to insert there. Pause, please. Okay, here's our drill guide coming into position. We're going to place the anchor right about here. It's like a good spot. So we'll take the drill. And we'll go right down into the bone. And then after the drill, we'll place our suture anchor down. And we'll tap it down with the mallet. So next we unload the inserter. We'll pull back on the suture anchor to seat it, just like that. Feels pretty solid. And next we'll take out one suture. Take it out here. And we're going to look in with our turn to the left hook and the grasper in the front. This hook that you see is loaded with a black wire called the super shuttle. You can see it right there. And now with our hook, we're going to go ahead and start here, rotate back. Pass. and the labrum here. But let me see. We're going to probe it and see if it's unstable enough to require an anchor. Pause, please. Okay, so now we have another loop around the labrum. Okay, so here's our second anchor in the back. As you look down at it, that looks very good. Okay, pause please. Okay, so here's what we're looking at. We're looking down the front now. We see some labrum, it's a little bit thin. This is the anterior band of the inferior glenohumeral ligament, right there. And we're just trying to scuff things up a little bit to create a healing response. And we're going to place one anchor, right? One anchor in the front, because it's going to give us, it's going to give us a little extra security. Come on over here with the drill. We'll show you some more in just a minute. Pause, please. Anchor down. We're going to take one suture out to the back. We'll take a turn to the right hook. First stitch right about here. Looks good there. This is going to be what we call a figure 8 stitch. We'll show you some more in a little bit. Pause, please. Okay, so there's our first mattress stitch in the front compared to where we were in the back. 2 in the back, 1 in the front. 6 o'clock is down here. We're looking from the top towards the bottom. So now we're going to bring this back a little bit. And that tightened, you can see how that tightened the anterior band of the inferior glenohumeral ligament, the IGL, which is the most important ligament in shoulder stability. So now we're going to go ahead and place a mattress stitch here without an anchor. We'll go ahead and show you how we do that. Back out right. Turn right. Here's our hook. We're going to start here. Then we're going to roll back. Get some of the joint capsule here. Bring that through right there. So we'll go ahead and load that, or feed that through and retrieve it carefully. And then we'll load that with a suture, and we'll show you some more in a minute. Pause, please. Okay, so we've tied a second mattress stitch in the front. That's basically the equivalent of 4 sutures in the front, and I'm happy with the way that looks. Things are very snug now. I'm going to put the scope in the back one last time here to have a look at the cuff and see if there's anything I need to do, or if that was just part of the interval tissue. Pause, please. Okay, so we're looking from the back to the front. This area where slap lesions happen is fine. Your biceps tendon is inserting into the labrum normally. That little area I was concerned about is really just part of the biceps sheath. So you have a little bit of a extra tissue around the biceps, and that's normal. We don't need to do anything significant with that. So we're going to go off on the video and get you back to the recovery room. Good luck to you now. Bye-bye.